to provide an update on COVID-19 in Tennessee and to talk about what we all can do to help limit the spread of the disease. Joining me today are Dr. Lisa Piercy, Dr. John Dunn, Dr. Mary Margaret Phil from the Department of Health, as well as Dr. Wendy Long, the President and CEO of the Tennessee Hospital Association. We have watched over the past week how Tennesseans have come together to address a tragedy amongst our neighbors as a result of the tornadoes. Now it's time, once again, to come together around a different challenge, COVID-19 in Tennessee. As the number of cases rise, the responsibility we each have rises as well. COVID-19 has officially been confirmed in Tennessee for a week, and we continue to gain more valuable information by the day during this evolving situation. We are in daily communication with other states and the federal government. And as a reminder, you can find daily information as well at coronavirus.gov and at tn.gov/health. We know that this is serious. We also know this is especially serious for our neighbors who are elderly. And this is why we must all take this seriously, even if you're not in the vulnerable population. While the risk to the general public remains low, the risk to vulnerable populations is very real. As a reminder, vulnerable populations include older adults and adults with underlying conditions like diabetes, heart disease, and respiratory illness. Vulnerable populations should stay home where possible, and certainly avoid large gatherings or places where they're most likely to contact the virus. This is a very unusual time, and because of that, it's important for each person to know that there are concrete things that you can do to help yourself, your family, and your community. I'm encouraging Tennesseans to avoid non-essential visits to nursing homes and hospitals. We ask Tennesseans to be vigilant about protecting the health of older family members, and colleagues, and friends and neighbors. Every day we learn more about this disease and its impact, and we will continue to adapt our position to fit what we believe is best for Tennesseans. As more individuals get sick, we realize that this means a greater need for resources to treat them. For that reason, this morning I signed Executive Order 14, which will move us into position to bring in additional funds from FEMA and relax certain laws which will make it easier to respond to this disease. This emergency declaration is an important next step in our efforts to treat and mitigate the impact of this disease. Many of our college campuses are making the decision to cancel classes or move to online classes. We understand this difficult decision, and we believe it's a decision best made in and by the communities most directly impacted. Earlier this week, we asked Tennessee insurers to consider waiving out-of-pocket costs for those seeking COVID-19 testing. We're encouraged by the response and commend the 8 health insurance companies who operate here that have all agreed to do so. As we continue to learn more, our response will continue to evolve. And I encourage everyone to stay vigilant in reading and sharing information from reliable sources. Continue to practice good hygiene by washing your hands often. If soap and water are not readily available, use a hand sanitizer. Cover your cough. Avoid touching your face. Avoid close contact with people who are sick. Stay home if you are sick. If you believe you've been exposed to COVID-19, contact your doctor. Put distance between yourself and other people. These are simple things, but they can make a big difference. We can slow down the spread of COVID-19, and it's critical that we take steps to do so. Stopping it from spreading quickly will ensure that our healthcare system can effectively manage the cases that present themselves in our state. As I conclude my remarks today, I want to make note to many of you in this room who've been working around the clock since last Tuesday. to cover developments and to provide the public with critical information. I commend your efforts, and I look forward to continuing to work together to provide information accurately and quickly. Now, let me turn it over to Dr. Piercy for further remarks.
Thank you, Governor Lee. I first want to echo the governor's comments about those of you who are dedicated to providing up-to-the-minute coverage of this rapidly evolving situation. As we continue to ramp up our mitigation efforts, communication with the general public is critical. In the week since we first announced our first case, I want to highlight some of the notable changes. First, we've had expanded case reporting on our website to include county-level data. There is a delicate balance between transparency and patient privacy, and although outside of our standard protocol, we want communities to be able to respond to this unique and evolving situation. We have also had emergence of private laboratory testing through commercial tests. While this is still early, we first received results from commercial laboratories yesterday. The state lab also continues to receive additional testing supplies and will continue to provide testing in addition to those commercial labs. As of this morning, we have enough supplies to test at least 500 individuals in the state lab, in addition to what's being done in private labs. We've issued continued guidance on school closures, mass gatherings, and travel, and I encourage you to pay attention to this, especially as families consider upcoming spring break plans. As we start to see more institutions and event planners make changes, please note that these actions are in an effort to flatten the curve. That's a phrase that you'll likely hear more about, and that deals with slowing the number of cases in order to reduce the strain on our hospitals, healthcare resources, and allow our communities more time to prepare. We've been ramping up our efforts for vulnerable populations, especially the elderly and those in nursing homes. We have had multiple interactions with all of these facilities statewide, encouraging limitation of visitation and ensuring appropriate infection control procedures are in place. Finally, our hospitals have also made significant strides in the last several days on their testing and response efforts. With us today is Dr. Wendy Long, President and CEO of the Tennessee Hospital Association, as well as member of the Governor's COVID-19 Task Force. I will now ask her to give us an update on Tennessee hospital preparedness. Thank you.
Good morning. Tennessee hospitals are working, as you might imagine, very closely with state and local public health officials to prepare for and respond to the surge in patients that we anticipate as a result of the COVID-19 epidemic. Hospitals have already begun implementing visitation policies and visitation screening processes. Hospitals are beginning to open alternative sites for screening and testing of non-urgent patients in order to assure that emergency departments continue to be available to treat true emergencies. Hospitals throughout the state are coordinating with other hospitals and with other healthcare providers within geographic locations to try to maximize access to needed resources to respond to this epidemic. And hospitals are preparing to implement strategies to increase available bed capacity as that need arises. We are concerned regarding the potential for supply, equipment, and manpower shortages down the road. That will depend very much on the scale and duration of the outbreak in Tennessee. We'll be monitoring all of those issues very closely, but we believe that Governor Lee's declaration of an emergency today will go a long way to providing us with additional options and opportunities to address those concerns. Thank you.
So that concludes our presentation. We will answer questions, and let me just close the formal remarks by saying that I believe we have an opportunity as Tennesseans to come together once again, that we can address this challenge that is before us. We have a great responsibility to address it, but it will take every single Tennessean to come together and do their part to mitigate the spread of this disease across our state and to provide for the best outcome possible in the weeks and months ahead. Happy to take your questions.
You said 2 days ago that we didn't need an emergency declaration until there were clusters. Why is it needed now?
Well, we have had more cases since those 2 days ago, and we believe there are more cases we believe there will clearly be more cases as expanded testing occurs, and the speed with which that is occurring was what caused us to consider making that decision.
Governor, this emergency declaration, you're saying it will open up some funds and you'll be able to access them. But we know that right now the state has $10 million from the federal government. I wonder what do you plan to do with that amount of money that you already have?
Well, I'll let Dr. Long specifically talk about what we believe costs will be going forward, but the emergency declaration also will not only free up the opportunity for us to receive additional funds when necessary, but it relaxes rules around licensure, around prescription regulation, numbers of days around getting a prescription. It will allow us to more effectively treat a surge of cases that come in our state, still protecting the public, but it relaxes rules around that. Dr. Pierce, you have comments about our anticipation of what those expenses might be, at least the first ones coming forward.
Specifically, if you can talk about those $10 million from the CDC.
Thank you for the question. We do have several funding mechanisms, but that one that you reference is the largest. We are in the process of compiling a list of things that, as we scale up, very well may have price tags associated with them. One of the primary things that we want to use the funding for is for telemedicine efforts. And this is not only in an effort to keep patients in their homes and talk to them remotely, but also to offload some of our emergency departments and clinics who not only may be more at risk with sick people in the waiting room, but also just from a volume standpoint. I'll ask Dr. Long to talk a little bit about what hospitals are doing specifically in that realm.
Certainly, hospitals provide a lot of outpatient care as well as inpatient care, and so we're beginning to look at what we can do to keep patients, particularly patients who are elderly or with chronic health conditions, to serve them at home and not require them to be in clinic. So we're looking at things like providing longer prescriptions than we normally would, say for 90 days as opposed to 30 days, providing some of those visits via telemedicine, as Dr. Piercy mentioned, is a high priority. Again, anything that we can do to free up beds and resources. Also looking at issues like canceling elective surgeries in order to free up beds, and really upping our efforts to discharge patients who are ready for discharge. So working with insurers to help patients transition to home with home health care or to other treatment settings if that would free up available beds.
But I'm not clear exactly what you are aiming to, where those federal funds you're asking for, where are you going to use those funds?
I think one priority for hospitals would be funding telemedicine. Those services are not always funded today.
Those efforts get up and be used.
I think hospitals would be in a position to provide telemedicine visits very, very quickly, immediately in many cases. So it's a question of funding.
Almost immediately?
Yes.
Okay.
Dr. Piercy, some questions about the testing. The 500 you've got from the state. Can you give us an idea of how many tests are in private labs as well, in addition to the 500?
That's a great question. I don't know how many private labs, what their testing capacity is right now, but there are multiple lab companies that are coming online and have done so in the last 7 days, and I've not been made aware of any restrictions or limitations on that testing capacity.
Do you have any idea how many people have requested to be tested so far in Tennessee?
I do not. We have processed, I believe, 69 tests through our lab, 68 or 69. Those numbers are on our website and updated every day at 2 p.m. And so what we're reporting from the state health lab perspective is number of positives, number of negatives, and number of tests completed through the state. On the private laboratories, you probably noticed we added a line item yesterday for positives from private laboratories. That's all they're required to report to us. And so we won't know the number of negatives or the number of total tests done from the private laboratories because there are multiple sources.
Do you have concern at all that there simply aren't enough tests?
That is not a concern of mine at this point.
Governor, I know one request was made yesterday for the speaker to temporarily adjourn the legislature, the House anyway. Do you feel like the legislature needs to go ahead and pass a temporary budget or short-term budget and leave town for 2 or 3 weeks until this settles down?
That's certainly a decision for the legislature to make. I will say that our F&A department and our administration is making preparations to present the budget as quickly as possible. So should the legislature decide to speed their process up, we'll be ready for that. But that decision will be up to the legislature. We just want to be prepared should they make a decision to move forward more rapidly than originally planned.
Sorry, when will you present the budget then? And will you have additional requests in there for coronavirus COVID-19?
We're talking about how we should potentially set aside funding to prepare for some of the unforeseens going forward. That'll be a part of our budget preparation. And we're working hard to get that budget completed as soon as possible, should the legislature decide to move any faster than originally planned.
Are you going to encourage the public to avoid buildings such as this, or the Court of Health building where there are hundreds of people gathered, despite the CDC's?
Well, we certainly are encouraging vulnerable population to stay away from folks as much as they can. And I would encourage every person to the degree that it is non-essential for them to have as much distance from crowds of people as they can. But people have to make those decisions individually. And the implications for those decisions are broad. So that'll be up to individual institutions and organizations and individuals themselves.
Just at this point, has anyone been hospitalized with COVID-19 in Tennessee?
I don't have the answer to that. One of you all?
Sure, I do. Good morning. The majority of patients in Tennessee have been well and received care at home through outpatient channels, but there have been 2 patients that have been hospitalized.
And are they still in the hospital?
I don't have the most up-to-date information on their status, but the last information we received was that they were doing well clinically.
And that they were doing well?
Yes, sir.
Governor, you talked about it's an individual decision for persons, employees, employers. But I'm wondering, what can the state do for those people who decide to stay at home because they might feel unsafe or they might feel safe? What can the state do to help them?
We can provide access to health services, which we are doing through our state health department. As was said earlier, we've encouraged healthcare companies to provide coverage and to provide treatment with no out-of-pocket costs to their patients. We're putting in place direct access to the healthcare safety net for those who are uninsured, to make sure that anyone who feels that they have potential exposure to this can be treated through our healthcare safety net at no cost to them if they're uninsured. So there are a number of ways that we can provide services to those who feel exposed.
Governor, your department initially declined to release county information from lower cases in outside the metro areas. That decision was later reversed. Do you think going back and forth and kind of playing around with what information is going to be released has hurt public trust in how the state is handling the situation?
What I think is really important is that this is an unfolding situation. And so what we do today may be expanded tomorrow. And what we do today to address this spread of this disease will impact tomorrow's spread. So that's why things change, because we have a fluid health situation in our state, and we will continue to change. And we encourage folks to stay vigilant in receiving information, because information does change. And there's much that's not known about this disease as it's traveled across the world. There are a lot of things we do know, and those are the decisions that we're trying to make decisions based on what we do know, but that's really the reason things change. I think that, and the public, we want to communicate that to them so that there isn't a mistrust, but just an understanding that continuously being connected to the evolving information is the best way to stay ahead of it.
We have time for one more question.
Just a quick follow-up, then do you imagine seeing, maybe age and gender later being released?
There, as you know, there's a real balance between patient protection, and so we'll take that into account, and as the situation changes, we'll consider everyday changes.
I have to ask about industry. There's a lot, if there's limitations of people going places, and we are subject to tourism-driven state, what's your concern about how this could impact the industry and the financial health of the state?
Certainly, we all know there are impacts, financial and otherwise, to making decisions about travel or gatherings. Closing a school, for example, in a district that might have a number of low-income students who receive 2 meals a day at school, that has a profound impact on those families. And so the decisions that individual institutions, organizations, and individuals themselves make that have serious implications, some of them economic, that we are concerned about. And that's why we encourage, every situation's different. Every decision is different, and every decision has different implications. That's why we are encouraging people to think long and hard about what those should be and take this very seriously as they make those decisions.
Thank you very much, everybody. That's the time.